So in this lecture, we'll be looking at immunity. Now, what is immunity? Immunity is the process by which the body fights against harmful invaders. Basically, that is what immunity is all about. Are you getting it? If you are able to fight against this harmful, if your body is able to fight against these harmful invaders, it means that your body is immune to that particular invader. So the ability or the process by which your body fights against harmful substances, are you getting it? The body's response to harmful substances is what we call immunity. Now, immunity can be broadly classified into two main types, right? We have innate immunity, which is also called non-specific, and adaptive immunity, which is also called specific immunity. Please note this. They may ask you in the exam to distinguish between innate immunity and adaptive immunity, not humanity, sorry. Immunity. Should be able to define. Or they may say, what is immunity? Classify immunity. Differentiate between active and passive immunity. That might just be the question that will come out. All right. So immunity can be broadly classified into two main types: innate immunity, adaptive immunity. Innate immunity is also called non-specific. When you say something is innate, my dear student, what does it mean? It means that that thing is in your body, like natural, is intrinsic. While adaptive immunity, which is also called specific immunity, is the one that as time goes on, when you say you are adaptive to something or you are adapted to something, it means ordinarily it was not there. But your body, or generally as time goes on, you get used to it. Is that okay? So we'll be able to distinguish between these two types of immunity as time goes on. Now, these two systems are not separate. The innate immunity and adaptive immunity, they are not separate. They work hand in hand with each other. They work with close collaboration with the innate immunity, providing a rapid first response and activating the slower, more precise adaptive immunity. Now, for the innate immunity, why do you say it's non-specific? It's not specific because it does not necessarily fight against a particular invader or substance that is, or foreign substance in your body. It fights against all. That is why we call it what? Non-specific. Are you getting it? Why the specific one just fight against specific invaders in your body? Two types of immunity: innate immunity, adaptive immunity. Now, both of them work together. The first line of defense, which is the first immunity, is the innate one. Then after the innate one, maybe it's not able to carry out the function, it will activate this adaptive immunity, which is the second one. This one is slower. Why this is faster? This is the first line of defense. Then this one comes in later. All right? Now, innate immunity. This is the body first line of defense. It is present from birth. That's why we call it what? Innate. When you say this person has an innate ability, are you getting it? It means from birth. It provides immediate but general protection. It is not specific. It fights against all foreign body and does not confer long-lasting immunity just for that specific period of time. If immediately you are able to overcome the innate immunity, there is nothing like after some time again. It just kind of for that moment. If you overcome it, you don't overcome am, you go to the next line of defense. It's more like, let us say, thieves came into an estate. The immediate immunity is the first people they have to meet, which are the estate securities. Are you getting it now? That estate security, they are the innate immunity. They are the first people you meet. If you are able to conquer the estate security, now the estate security, is it protecting any specific person? No. That estate security is protecting everybody. It's fighting against any foreign body, whether it is coming from Mr. A or Mr. B. This foreign invader, estate security, is protecting both Mr. A, Mr. B, Mr. C, Mr. D, everybody. Once you overcome this one, then the next line of defense will be what? Activated. All right? Now, what are some of the characteristics of the innate immunity? So we say this is the body first line of defense. It's present from birth. That's why it is innate. So when you hear the word innate, it's present from birth. It provides immediate. That's why we say it is fast, but general protection. Protection is general, covering everybody, and does not confer long-lasting immunity. Characteristics. One, it is not specific. Innate immunity protects everybody. It's not specific to just a particular pathogen. It responds to all pathogens in the same way. Rapid response. They act within minutes to hours. Are you getting it? No memory. They don't respond to a pathogen the same way every time with no increase. I mean, they respond to a pathogen the same way every time with no increased intensity upon re-exposure. They don't have any memory. That's why we say they don't confer long-lasting immunity. Are you getting it? They respond to the thieves the same way, the same time. They don't remember, now this particular one I come last time. Oh yeah, oh, fast. Let's kill it. No. They respond the same way. Are you getting it now? Now, what are the components of innate immunity? The first line of defense, the barriers you have. Innate immunity, they are divided into first line of defense and second line of defense. Are you getting it? We have natural barriers. Natural barriers. That is one of the subdivision of innate immunity. These include things like physical, things that you can see, physical, like your skin. Your skin is innate immunity. Now, before pathogen enter your body, the skin has to block them first. Let us say you have a cut in your skin. That is when bacteria cannot go into your body. But without no cut in your skin, that bacteria may just remain on the surface of the skin. If it does not penetrate, at the end of the day, you can wash it off. So your skin is the first line of defense, is under physical. The mucous membrane lining the respiratory, the GIT, and the urogenital tract, they are all what? Physical innate immunity, because they prevent substances. For instance, look at your nose, there are hairs there. Are you getting it? Those ones, they prevent substances from going in. They are part of the innate immunity. Mucus produce. They actually help flush harmful substances away. They are part of the what? Innate immunity. Then chemicals like the stomach acid that aid in digestion. Sometimes, not all bacteria can actually survive this stomach acid. So when they get there, they die. They are innate immunity. Lysozymes in tears and saliva, they are innate immunity. These ones, they kill. That's why they call them lysozymes. Are you getting it? They are capable of breaking down harmful foreign substances, like the tears. Are you getting it? That is why most time when you tears, you are washing off some things. Your eyes become clearer. Is that true? Sometimes when you cry, at the end of the day, your eye becomes red and so on. But that tears you are actually releasing, it helps clean the eye and makes everything okay. Then biological, like the normal flora, the good bacteria that outcompete pathogens, like in your vagina, there are normal flora. In your GIT, there are normal flora, right? Now, those normal flora, if the bad bacteria overgrow the normal flora or outcompete the normal flora, that is when you now start having issues. Are you getting it? These normal flora, they are the good bacteria that maintain the health of places like your GIT and your vagina for the ladies. All right, those ones, they are under innate immunity. So the component of innate immunity, you have the natural barriers like the skin, mucous membrane, GIT, urogenital, chemicals, stomach acid, lysozyme in tears, biological like the normal flora. Are you getting it? That outcompete pathogens. The normal flora, they are the good bacteria in your GIT. When they don't too grow, that is when you now start having overgrowth of so. Is that okay? So that is that. Now, the second line of defense is also under innate immunity. The second line of defense is also under innate immunity. The ones we discuss are physical barriers, the ones that are kind of you can see. Then the second line, which is innate immunity, we have internal defense. These ones, they are not external like the ones we discuss. Internal defenses like the phagocytic cells, neutrophil, and macrophages, which mature from monocyte. We talked about monocyte the other time. We said monocytes, they are the agranulocytes that engulf and digest pathogens. These ones, they are under innate immunity. They are phagocytic cells. Phagocytes, when something is a phagocyte, it means it engulf, it destroy, it takes in and destroy it by releasing enzymes that break the substance or that particular pathogen down. Then we have the natural killer cells. These are lymphocytes that recognize and kill virus-infected cells and tumor cells. Now, there's a process called the activation of the complement system, where some bacterial cells are marked. They mark them, they give them symbol that this is a bacterial cell, we want you to kill it. This natural killer cell, we see them and then eat them or kill them. That process is called opsonization. Opsonization, but that is too complex for this quick revision class. Phagocytic cells, natural killer cells, and inflammatory response is also the second line of defense. Inflammatory response characterize a localized response to tissue injury or infection. Are you getting it? That is characterized by redness, heat, swelling, pain, and loss of function. These are the classical symptoms of inflammation: redness, rubor, heat, dolor, swelling. I think there's a name for swelling, forget swelling, then pain. Are you getting it? And then loss of function, function latia, something like that. These are the classical symptoms of inflammation. What do we mean by classical features of inflammation? We are talking about when somewhere is inflamed. What are some of those things that you should be expecting to see? Are you getting it? For instance, let's say you discover that a particular place in your body is swollen up. Let's say it is inflamed. When you say something is inflamed, what are some of the things that make you say, okay, this particular thing is inflamed? Maybe the place will be hot, yes, as compared to other part of your body, right? The place might swell. The place might become red, rubor. The place may become very painful, and sometimes it may even lose the function like what it's supposed to do. So these inflammatory response are also parts of the immune response. Are you getting it? It helps to what? To isolate. When all these things happen, redness, heat, swelling, and pain, it actually isolates and destroy and remove the invader and also initiate repair. So these are also under the innate immunity. These ones, they are the ones that your body naturally do from birth. What do we say? We have the barriers, physical barrier, chemical barrier, biological barriers. Then we now have the internal defenses like the phagocytic cells, natural killer cells, inflammatory response. All right. Natural killer cells, they are lymphocytes, which we say they are under which type of blood cells? White blood cells. We say the white blood cells are the army of the body, and these lymphocytes, they are the agranulocytes, which we discussed. They are lymphocytes that can recognize and kill virus-infected cells and tumor cells, cells that are replicating, that have the tendency of replicating and causing cancer. The natural killer cell just mark them and then destroy them. Is that okay? So when you start having inflammatory response like redness, heat, swelling, and pain, it does not necessarily mean that that particular person is that is like an immune response. Are you getting it? To a foreign thing that might have invaded your body. Is that understood? Then we have antimicrobial proteins like complement system. This one is a little bit more complex for you to understand for now. Are you getting it? So just leave that antimicrobial proteins. Exactly. So just leave them. Now the next one is the adaptive immunity. What is adaptive immunity? This is the body's third line of defense. Third line. So first and second line is what? Innate immunity. Once those first two will not actually carry out the function of removing that harmful invader or pathogen from the body, the third line of defense is what? Is activated. It is specific. It's not like innate immunity that is what? General. Innate immunity, all these ones we are talking about, they are general. They don't actually respond to a particular pathogen. All pathogens that come into the body. Are you getting it? Exactly. Now, adaptive immunity, this is the body third line of defense. It is acquired throughout life. It's highly specific to individual pathogens and has a memory component that leads to a stronger and faster response upon re-exposure. The basis for vaccination rather. The basis for vaccination. Now, what do we mean by this adaptive immunity? Let me explain to you guys so that you will understand. Now, the adaptive immunity is the third line of defense. It is acquired throughout life. Like, it's not something that you just acquire at once. It's throughout the life. And it has a memory component. Now, this memory component is more like the thing. They are like things when we say it is store, say, oh, we don't see this pathogen before. If you don't see person before, for instance, there are some of you that, okay, you don't really know, you've been hearing the name Miller. You don't really know who Miller is. Probably now I'm making a video and you've seen this face. Is this the person? Are you getting it? If you see me somewhere again, you will immediately know that, yes, this is him. Then upon continuously, maybe the first time you saw me, you may still be doubting, now him be this, now him be this. This person resemble that person when they did the video. If it be him, then you see me again, maybe you come ascertain, say, okay, now me be that. Let's say you now see me the second time, you may still be, maybe it depends on the kind of clothes I may wear. Be like, I may be putting on before I say I may wear. I may be putting on. I may look quite different from how you saw me the first time. Are you getting it? At the end of the day, you now be like, is this the person? Yes. But if you continuously see me for like 1 week, 2 weeks, 3 weeks, 4 months, sometimes even by looking at my back without seeing my face, you'll be able to know that, hey, now be this. Are you getting it? That is how this memory they are. Once the pathogen enter, it dey store memory for the immune cells. The immune cells dey store memory, which is the adaptive immunity. The immune cells that carry out this adaptive immunity, they store memory and say, pam, na this person. So when the pathogen enter your body again, e go still store immunity. So the more you are exposed to that pathogen, the more your body is naturally what? Like remembering that na this person know. So let's say after some time now, that particular pathogen can enter, the response will be very fast. How to remove and say, na him be this, na him be this. Are you getting it? Na him be this, let's remove it. Na him be this. Why? Because it has a component, the memory component, that actually keeps record of this particular pathogen, like how the body has been exposed to it over the time. And that is the basis for what? Vaccination. Now, what are the characteristics of adaptive immunity? It is antigen specific. Now, what do we mean by it is antigen specific? It recognizes and targets specific antigens or specific molecules called antigens. It recognizes and targets specific molecules called antigens. That's why we say it is antigen specific. Just specific ones, not just any or general antigen. Systemic. It is not restricted to the initial infection site. General, systemic. All right. Now, the next one is that it has memory. Adaptive immunity has memory that remembers wetin don happen before. All right. Now, component of the adaptive immunity, it has two main components. We have the humoral and the cell-mediated immunity. Is that okay? We have the humoral immunity and the cell-mediated immunity. Is that okay? Now, my dear student, what is humoral immunity? They are the main cells. They are the main cells. Please take notes. Two components of adaptive immunity: humoral or antibody-mediated immunity. Humoral or antibody-mediated. This one is telling you that now antibody now they carry out the immune function. all right, and cell-mediated immunity. This one is telling you say na specific cells na im dey carry out the function. So types of adaptive immunity: humoral and cell-mediated. Humoral is also called antibody-mediated, telling you that antibodies are produced. Na that antibodies na im dey fight. Then cell-mediated telling you that na cells na im dey carry out the functions. All right. So for the humoral immunity, the main cells are the B lymphocytes. The main cells are the what? The B lymphocyte. Remember, I said lymphocyte, they are component of what? White blood cell. All right? Never let monkey. That let is lymphocytes. And they are what? Agranulocytes. We have two types of lymphocytes. We have the B lymphocytes and we have the T lymphocytes. The B lymphocytes are the main cells that are responsible for this antibody-mediated immunity, which is also called humoral immunity. Now, these B cells are activated when they encounter their specific antigen. They proliferate and differentiate into the plasma cells and the memory B cells. I told you that these B cells, they are activated when they encounter their what? Specific antigens. Are you getting? What are the B cells? They produce antibodies. Are you getting it? So when the cells meet an antigen, these B cells are activated and then they will multiply and then they will split into two. We now have what we call the plasma cells and the memory B cells. All right? The plasma cells, they are the factory that produce and secrete large amount of antibodies, which we call immunoglobulin. The plasma cells. These immunoglobulins are the ones that are actually responsible for the antibody-mediated immunity produced by the plasma cell. While the memory B cells, they are the ones that remember the particular antigen for a faster future response. Remember, when we talk about antigen, we are talking about that foreign thing when they enter the body. So let me explain in very simple way. See wetin dey happen. When foreign thing enter the body, and that foreign thing, the particular B cells, they get particular antigens when they fight against for the body. Every B cell have a particular foreign thing when they fight. That is why we say it's specific. Are you getting it? So when a particular foreign body enters and it complements the antigen when they go fight, that B cells now go dey activated. When it dey activated first, e go first split into two. The B cells go first split into two. We go come get wetin they call plasma cell, and then the next one go be wetin? Memory B cell. The plasma cell now go come secrete the antibody. The antibody now go fight against the antigen. Are you getting it? The antibody will fight against the foreign body, which is the antigen. Why the memory B cell now go come keep record say this kind thing don happen before, so that in case that antigen enter the body again or that foreign thing enter the body again, e go immediately tell that particular B cell to what? Release more plasma cell to produce what? More antibodies, which is immunoglobulin, that will fight that particular foreign substance again coming into the body. So idea is a particular antigen, when e enter the body, or foreign substance, maybe a pathogen, maybe na measles or anything, when e enter the body, first, if e dey that particular B cell, they get their own antigen when they fight against. If it correspond to the antigen when that particular B cell they fight against, the B cells go dey activated. Once e dey activated, e go split into two: plasma cell and memory B cell. The plasma cell go produce antibodies, which are like the soldiers, the main soldiers fighting the fight, which will fight against that antigen to wipe it off the body. While the memory B cell will keep record of what has happened. Now, what are the functions of the antibodies? Antibodies circulate in the blood and the lymph. They bind to antigens, neutralizing them. They bind to what? Antigens, the foreign substance. They bind to the foreign substance, neutralizing them and marking them for destruction by phagocytes, which is opsonization, and activating the complement system. Now, this process is something that is kind of not an easy thing for you guys to understand at this level. Me, I didn't understand when I was in 200 level. I think I only understood it in 400 level, right? When we did this course as a special course on its own, the pharmaceutical microbiology. The general idea is that particular memory B cell, the B cells, which are the plasma cells, that antibodies, when we say that they produce, not be the antibody they kill the cell. Not be the antibody they kill the antigen. Not be the antibody now they kill the foreign substance. When I say antigen, no say na the foreign substance wey enter the body, that disease, that pathogen wey enter the body. Not be the antibody they kill am. Wetin the antigens they do, the antibody they do be say, once they spot a particular antigen, they go attach themselves to am. They bind to the antigen. After they bind to the antigen, go neutralize them. Kind of, they cannot do their work again. Are you getting it? Now, wetin dey really dey kill them. Now, as they neutralize them, they go don get a particular, more like the antibody dey wear uniform give the antigen say this particular person na foreign person, so make soldiers come carry am kill them. Are you getting it? So when the antibody bind to antigens, that antigen now will be visible to be destroyed by phagocytes in a process called opsonization. So opsonization is like something that is like making something to be very obvious to be destroyed, like making it to something that was hidden to be very obvious so that they could fit destroy am. Are you getting it? That is the process of opsonization, and then activating the complement system. They defend against extracellular pathogens, e.g., bacteria, viruses in blood, in lymph, and in toxins. Then we have the cell-mediated immunity. The main cells in cell-mediated immunity are the T lymphocytes. They are the one, my dear student, T lymphocyte. What did I say are the main cells in humoral immunity? B lymphocyte. Then this one, they are the what? T lymphocyte. T cells must be presented with antigen by T cell must be presented with antigen by specialized antigen-presenting cells like macrophage. They then differentiate into helper T cells, cytotoxic T cells, and then regulatory T cells, and then defend against. This one is kind of too complex for you guys to understand. We have to start explaining the whole process again. But just know that cell-mediated immunity, the main cells responsible for that is the T lymphocyte. All right, that is the most important thing. And you should know differences between the adaptive immunity and innate immunity, which we have looked at before. Now, the next question is differentiate between active and passive immunity. What is the difference? Active immunity, the body produces its own antibodies and memory cells. It is long lasting. This one, and the body, they produce its own antibodies. What are antibodies? The things that fight against foreign substance, that fight against antigen. So a type of immunity where the body produces its own antibodies and memory cells is known as active immunity. It is long lasting, and it is divided into natural active immunity and artificial active immunity. Natural active immunity is acquired through infection. For instance, if you don't get chickenpox before, you may never get it in life again. Why? Because immediately you get them, your body don't dey immune to that chickenpox. Are you getting it now? So that one is natural active. So over the years, even if you dey exposed to them again, because you don't get that before, your body don already keep memories. Okay, this thing don't come. So immediately chickenpox enter, antibodies will be produced, and then they'll fight against it. That is why if you have chickenpox before, you may never come down with it again. Then we have artificial. Artificial is the one acquired through vaccine, like the MMRO vaccine. Are you getting it? So the MMRO vaccine is given for measles and co. Now, this vaccine is vaccination generally, acquired through vaccination. What you do in vaccination is that you actually inject the person with an organism, like the pathogen. Are you getting it? For instance, if you want to fight against, let's say, tuberculosis, there's a vaccine called BCG vaccine. Are you getting it? If you want to fight against tuberculosis, there's a vaccine called BCG, Bacillus Calmette Guerin, or something like that. Now, you vaccinate the person against it by what? First of all, you kind of like inject the person with that pathogen. Although it's not pathogenic. No, let's not say pathogen. You inject the person with the vaccine. Is the organism. Are you getting it? More like the way infection they infect person. Do you get it? Then your body go know say, okay, this particular infection don dey there before. Na wetin vaccine dey do. But vaccine now be say you no dey get the infection naturally. You dey get am through vaccination. But this vaccination now, e no go give you any kind of sickness. So, are you getting it? E no go give you any kind of sickness. E go just make your body produce those antibodies as if the sickness dey there, but it is not really there. So that in case when the sickness really come, they don already keep memory say, like deceiving your body that that sickness don come before, whereas e never really come. So that immediately that sickness come, that memory cell wey don keep am say e don go record am say something like that don come before, whereas e never come, they will be activated to fight against that sickness. That is how vaccination work. Do you understand what I just said? I said active immunity na when your body produces own antibody and memory base and is divided into natural and artificial. Ma use pidgin English explain am. The first one, natural, na through infection. If you get infection, for instance, you get chickenpox, you discover that after you get chickenpox, once exposure, what will happen? Your body will now produce antibodies and memory cells for chickenpox. So anytime when chickenpox try wan get into your body, because those soldiers, they don already know say, oh, this thing don come before, wetin go happen? They go fight against am. You can no longer come down with chickenpox. Are you getting it? That is natural. Then for artificial, through vaccination. Now, a vaccine is like organisms, like the infection. When we say we put am inside bottle, we come inject you with am. Although e no dey cause any sickness for your body. Oh. Are you getting it? Because it's non-pathogenic. It's not pathogenic, like it doesn't cause any disease. But we go first inject am. Now, that vaccine now go come deceive your body, say, okay, we don get infection for this body before. Are you getting it? For instance, tuberculosis, like, or measles, MMR. Are you getting it? Now, when you inject that person with that particular vaccine, it will come deceive your body, say this thing don come before, whereas it never come. Are you getting it? Deceiving your body to produce those antibodies so that in case that particular pathogen come, we don already like secure people wey go fight against am, because we don already first deceive am to make sure say everybody dey do wetin don dey ready. Do you get the idea? Exactly. So that is artificial immunity, and it's acquired through vaccination. So vaccination is active artificial immunity. Active what? Artificial immunity. Then we have passive immunity. The individual receives pre-made antibodies. Receives what, my dear student? Pre-made antibodies. It provides immediate but short-term protection, weeks to months, as no memory cells are formed. For the active, now your body dey produce the antibodies and the memory cells. For passive, na pre-made, like they don already make am for ground. No be say na your body dey receive am, like the one they don already make, you dey take am in. That is passive. Are you getting it now? And there is no memory cell, so you cannot even remember whether this kind of thing happened before or not happen. But it provides immediate but short-term protection. It can also be divided into natural and artificial. Natural na the antibodies pass from mothers to fetus via placenta or to infant via breast milk. Now, the mother's antibodies can be passed to the child through the placenta in order for the child to be able to fight against any kind of disease when go worry that fetus inside the belly. At the same time, your breast milk also contain antibodies that help that child to fight against particular diseases. That is why they say exclusive breastfeeding for a particular period of time. Are you getting it? In such a way that before you stop your child, because for the first, I think, 6 months of giving birth, your child no fit actually do it. E no fit produce antibodies. Your pikin body no fit produce antibody. I think for the first 6 months or so, or the first 6 weeks, 6 months or 6 weeks. I can't really place my hand. That is not my area. Are you getting it? Your body cannot really, that baby, infant cannot produce any antibody. So when you dey breastfeed, they give that pikin breast, it actually help that child to what? To fight against this one. So that one is pre-made because na the mama dey make am transfer am to that pikin. Is that understood? It's pre-made. That is passive immunity, but it's natural in the sense that it's coming from living, like you are passing it, not like something that is synthesized in the lab also. So it's natural. Then the other one is artificial, when you inject immune serum or antibodies. Like you prepare antibodies in the lab and then you inject it to the person. That one is what? Artificial passive immunity because it's pre-made. Are you getting the e.g. antivenom for snake bite that fight against snake bite and monoclonal antibody therapy? So that is that for immunity. All right. Then the last thing I think is the concept of blood grouping and compatibility. I believe everybody already have an idea of this one even before now. Blood grouping and compatibility. Now, the success and safety of a transfusion depend entirely on matching blood type of the donor and the recipient. This is governed by the presence or absence of antigens on the surface of red blood cells and antibodies in the plasma. Now, antigens are present in red blood cells, antibodies in the plasma, which is the blood plasma. You know, we said blood consists of what? The formed element and plasma. One of the formed elements is the red blood cells. Antigens are on that surface of the red blood cell, while the antibodies are in the plasma. Now, the general idea is this. Listen, general idea is this. If antibody dey the plasma, you cannot give a blood that contain that particular antigen that antibody will fight. Do you get it? Antigens are present in red blood cell. Antibodies are in the plasma. Wetin I dey try tell you now be say antibodies are in the plasma. You cannot give a blood that contain the antigen that antibody will fight. Is that okay? So for instance now, let us say the person get antibody A. You cannot give a blood that contain antigen A. Is that okay? Person get antibody A. You cannot give a blood that have antigen A. Why? Because both of them will react. If person get now, if person get antigen B, you cannot give a blood that contain antibody B because both of them will what? Will react. Is that okay? So that is the general idea. Now, this is the ABO system. This is the most important blood group system. Group A has antigen A on red blood cells and antigen B antibody in plasma. So for somebody that have group A, blood group A, it has antigen A on red blood cells and antigen B in plasma. It means that that person will also receive from somebody that also have antigen A on red blood cells and antigen B on what? Antibody. Are you getting it? This one is the person that has it. This one is the donor. The donor must have antigen A and antigen B because it has antigen A, antigen B. Antigen A and antigen B no dey react. Are you getting it? So they can donate. Now, group B has B antigen and anti-A antibody rather. Now, what does this mean? See, if you give person wey be group A to group B or group B to group A, remember that group B has what? B antigen. And what? A antibodies. Remember that this A antibody go fight A antigen. Are you getting it? This B antibody go fight B antigen. And at the end of the day, there will be agglutination. That is the reason why you cannot give somebody that is A, you cannot give it to what? B. And somebody that is A, you can't give it to B. And somebody that is B, you cannot give it to A. Why? Because of the incompatibility. So the general idea here is that blood group A should go to A, B should go to B. Group AB has both A and B antigen. but no antibody, and this person is the universal what recipient. This one can receive anyone because it does not have any antibody that will fight. Are you getting it? No antibody, so it can go to anybody. It can receive from anybody. All right. Group O is has no A and B antigen, so it can give to anybody, hence the universal donor. So you should be able to classify this blood grouping. All right. That will be all for this particular one. We'll see in the next one.